So there's going to be a vaccine that comes out soon. And so is that the kind of thing that somebody would come to your company and say, look, we need to get somewhere in the neighborhood of 65%. We have this many that distrust, this many, we have the statistics, we know what it is. And people, I know some people who are in public health and whatnot are scratching their head today going, I don't know how we're going to get to this 65, 70%. Is that the kind of thing your organization does?
That would be spot on. So my co-founders are Kevin Volpe and David Ash. They are academics at Wharton School. Dr. Volpe runs the NIH-funded Center for Health and Science and Behavioral Economics, and Dr. Ash is heavily involved in Penn Medicine's Nudge Unit. And so they have the raw science that's been published in peer-reviewed journals, New England Journal and JAMA, and we at Val Health bring this out into the real world. And I recently read an op-ed from a great economist saying that the government should pay every American $1,000 to go get their vaccines. And I wanted to pull my hair out because I think that is the worst idea we possibly could do as a country for a couple of reasons. One, what's the statistic? 30, 40, 50% of people say they're going to go get a vaccine anyway. So you're paying them for what they would have done. So that's going to cost us $150 billion. As the other half are now going to do some decision tree in their head of the government is trying to pay me because they think this isn't a good vaccine and there's going to be all kinds of side effects and they're trying to bribe me with $1,000. And that's completely irrational. And so what we know we need to do on the vaccine side is you need to have local presence and campaigns. So I live in the New York City area. If you have the mayor or governor here doing a campaign and they air it in Texas, it's going to make no sense. So you need to find local communities, and the vaccine needs to come down to the local level of you're doing it for the safety of your community, you're doing it for the reopening of your community. It's not about the broader country and it's not about the broader globe. People are going to respond more to personalization. We know that.